So we'll discuss about reflex. Reflex is an involuntary, predictable, and specific response to a stimulus dependent on an intact reflex arc. Reflex arc includes sensory receptor, afferent neurons, efferent neurons, and responding muscles or the glands. So there are two types of reflexes: deep tendon reflex and superficial reflex. Deep tendon reflex are the results from stimulation of stretch sensitive 1A afferents of the neuromuscular spindle, producing muscle contraction via a monosynaptic pathway. They are tested by tapping sharply over the muscle tendon with a standard reflex hammer or with the tips of the therapist's fingers. To ensure adequate response, the muscle is positioned in mid-range and the patient is instructed to relax. Stimulation can result in observable movement of the joint, that is brisk or strong responses. Weak responses may be evident only with palpation, that is light or sluggish response with little or no joint movement. Superficial cutaneous reflexes, they are elicited with a light stroke applied to the skin. The expected response is brief contraction of the muscle innervated by the same same spinal segment receiving the afferent inputs from the cutaneous receptors. A stimulus that is strong may produce irradiation of the cutaneous signals with activation of protective withdrawal reflexes. Cutaneous reflex include the plantar reflex, conforming toe signs, that is Chaddock signs, and abdominal reflex. The reflexes are graded on a scale of 0 to 4 plus. So 0, 1 plus, 2 plus, 3 plus, and 4 plus. 0 is absent or no response. 1 plus is slight reflex, present but depressed or low normal. 2 plus is normal or typical reflex. 3 plus is brisk reflex, possibly but not necessarily abnormal. 3 plus is very brisk reflex, abnormal, and clonus may be present. Today we will see the deep tendon reflex for knee jerk, also called as patellar jerk. The root value is L2, L3, L4. And for superficial reflex, we will see the plantar reflex, that is the root values are S1 and S2. To assess deep tendon reflex, on normals, the subject is seated in a high seated position where the subject should be relaxed completely, and the therapist gives a strike on the patellar tendon, and the reflex is elicited and noted. The other position for knee jerk is in supine position, where the limb to be assessed is relaxed on the therapist's arm and the other limb is in hip knee flexion so that the therapist can hold the other knee. And the hammer is strike on the patellar tendon and the reflex is elicited and recorded. For superficial reflex, the patient or the subject is lying in supine. The foot is in relaxed position, and the therapist strikes from the heel on the plantar aspect to laterally towards the head of the first metatarsal. The normal reflex is elicited as dorsiflexion or there will be withdrawal. The abnormal reflex which is seen in patient is there is Babinski sign, which is fanning of the toes, and there will be plantar flexion of the foot.